everyone, my name is LORIE-ANN Bachelor of Science in Midwifery, studied at Isabela State University, Ilagan campus. Today, I'm here to demonstrate the essential Intrapartum newborn care or EINC.
For today, I'm going to perform the essential Intrapartum newborn care or EINC. The rationale for doing this is to reduce the mortality risk of newborn and also provide quality care that the mother and the newborn needs. For this procedure, we need first to ensure the woman's privacy, especially now that she will be giving a birth. So the privacy is important in order her to be comfortable, that is promote the successful delivery for the baby. We will now proceed on preparing the equipment that we'll be needing for this procedure. So, this is the 2 pair of gloves, 2 dry blankets, 1 bonnet, and the cord care set, which include the plastic umbilical clamp. I use this for a substitute. Next is the surgical clamp. I'm also use this for substitute, and the surgical scissor. We will also needing an oxytocin injection, then also the notromacin ointment. So, let's assume that this is ointment, and the vitamin K and hepatitis B vaccine. After that, I need to wash my hand and remove all of jewelries because it can be carrying of microorganisms. So, the rationale for doing this procedure is to prevent spreading of microorganisms, especially now that I will be handling the newborn, thus being sterile important. Now, I will be going to put the 2 pair of surgical gloves, so maintaining the sterile important in preparing the gloves. Next is the second pair of gloves. This is we call double gloving. So now, I'm already wearing the 2 pair of gloves. So the first 3 minutes, you have to call when the time of the baby is out and pronounce its sex. After the baby is out, 8 o'clock p.m., this is a female. And after that, we have to dry the baby surely, starting from the face and head. Going down to the trunk and extremities for at least 30 seconds. Then after that, we have covered the head of the baby using the bonnet. And then with the dry blanket. So, we have to cover the baby with this. Then after that, I have to remove the first pair of my gloves, then dispose. And then I have to palpate the umbilical cord and check for palpation. After palpation stop, clamp the umbilical cord using the plastic cord clamp at 2 cm from base. After that, I need now to apply the surgical clamp from the base of the umbilicus. I cut near to the plastic umbilical clamp using the surgical scissor. that, I need now to inject the oxytocin into the mother's arm. And after that, we need to deliver the placenta and then check for the heavy bleeding and examine the perineum. So after 30 minutes to 1 hour after birth, we need to maintain the skin-to-skin contact and also allowed to breastfeed. Then after that, we need to administer the eye ointment on the baby. And the next is we need to administer the vaccine, the vitamin K and hepatitis B vaccines for the baby in intramuscular. And also we need to promote the rooming of the mother and the newborn, and the bathing can be done after 6 hours. So this is important that bath the baby immediately to prevent the hypothermia, and the next is perform the hand hygiene and observe bleed the infection control procedures. The rationale for doing this is to prevent the spreading of microorganisms. After doing the procedure, I need also the documents all of the data that I gathered and also the procedure that I have done. Thank you.